Okay, so we're moving on down here. This is our big, huge femur. Largest bone in the body. Makes an incredibly good club. And you'll see that this is the head of the femur here. Now this is a right, by the way, and this is a left, so this is not going to match up properly, but you guys get the idea where the head of the femur is going to sit in that acetabular cup there, if you will, and this makes up the hip joint. So this right here, I forgot to mention this coxal bone is the pelvic girdle, right? Where does it articulate? It articulates with the sacrum right here at the auricular surface of the coxal bone, or of the ilium. So we're moving down to the femur. The femur, again, if you can imagine, you got all those big fat gluteal muscles and quadriceps that are originating from the femur. You also have big muscles that are inserting in the femur, like our hip flexors, for example, and they make trochanters. This is the only place on the body you're going to find a trochanter. A trochanter is a big, fat, roughened bump, larger than a tubercle. And we have the greater trochanter here, and then we have the lesser trochanter here. Can't really see it that well until I flip it over to the posterior side, and now we can see it, to a greater degree. This is the greater trochanter, and then this is the lesser trochanter. Gluteus muscles, hip flexor muscles insert there. This is the intertrochanteric crest, posterior, and then on the anterior side, we kind of have this imaginary line in between greater and lesser, and this is the intertrochanteric line. Line anterior, crest posterior. Oh, I forgot to mention, we have a fovea capitis in the head of the femur. Does everybody see this indentation right there at the tip of my finger? And if you look at it, this is kind of busted off. It's not this large. But if you look at any fovea capitis, and I encourage you to do this, you're going to find a fairly large hole that runs right through the center of it, and that is a very important structure because we have a ligament, not only a ligament known as the ligament teres, but we also have with that ligament runs the entire blood supply that feeds into and supplies this proximal epiphyseal region. You tear that ligament, you tear that blood vessel, you are in a whole heap of trouble because your entire epiphyseal portion of your femur is going to waste away. You're not getting blood supply in there anymore. Okay. So I'm going to flip this femur posteriorly, and I'm now looking at the back part of the femur, and this is a really pronounced, you guys see this right here? This bony kind of, what are they called? It will come to me. Anyhow, bony growths at this point. And we have this line right here in the posterior femur, and that's called the linea aspera. The linea aspera, believe it or not, is an origin point for 3 of your 4 quadriceps muscles, your thigh muscles. Say, wait, Trent, your thigh muscles start at the back of your leg, and then they turn around front, and they insert right here, and the answer is yes. Okay, well, again, I've told my class this particular set of bones was from a laborer. This dude worked his butt off in life. You can tell because he's got evidence of that on his bones, especially with these bony growths on the linea aspera. This is huge, very, very prominent, very pronounced. He did a lot of leg extensions in his life, probably a lot of bending over, picking things up. Moving on down here, again, this is the anterior portion of the femur. And you'll notice, again, we have our knuckle-like structures. These are the condyles here. But we have, well, you can see them from the posterior region better, right? Knuckle-like, yeah? These are condyles. And this is the intercondylar fossa that my finger's sitting in. But if we go to the anterior side, you see on top of these condyles, there's a very slick, slippery area, smooth. And that is where our patella sits. This is the patellar surface of the femur. And remember, you're not going to see, if you were to crack something open, you're not going to see bone. What are you going to see? You're going to see hyaline cartilage, because this is an articular surface. This whole knee joint, of course, has hyaline cartilage on the articulating surfaces of both sides of the bones. So these are the condyles, and then these are the epi, where my fingertips are the epicondyles. Moving on down south here to inferior, or distal rather, down the tibia, and you will notice that the tibia has condyles as well. So these are the condyles we're seeing, and this is the intercondylar eminence. This is this. You guys see this bump in the middle of the condyles of the tibia? That's the intercondylar eminence, and these are the articulating surfaces that again articulate, with the articulating surfaces of the femur. However, as if you guys seen the latest lecture, you know that there are, not the latest, but a few lectures ago, you know that there are meniscus that sit in this knee joint, right? Meniscus obviously are cartilage, and that does not last. So you're just seeing the skeletal components of the knee. Then you'll notice here that we have this big, fat, roughened structure here. If I turn it sideways, you can see how this is kind of peeking off. And this is the tibial tuberosity. It's a very important attachment point because this is where your quadricep muscle or your thighs attach to. Like I told my class, you guys don't need to know this, but this guy has Osgood-Schlatters disease. It's where you have this big old bump on your knee. Or I should say your tibial tuberosity specific. Then, I forgot to point this out before, there's a structure, think proximal medial tibia, and what you're seeing here is this roughened area, and this area is what's known as the pes anserine. That translates in Latin to the goose's foot. There are three tendons that branch off of this area right here, that when you look at them with the tendons intact, it looks like a goose's foot. That's why it's called that. But the remnants on the bone is just simply called the pes anserine, and that's in this roughened area. Do not confuse the pes anserine with the tibial tuberosity. They're obviously very different things, attachment points for different musculature. As we move down the tibia, this is our shin bone, right? This is the hard part. You smack your shin and it hurts because it's exposed. This is one of these bones that's literally exposed, almost, sits right beneath the surface of the skin. You'll notice that we have the head of the fibula here, and then the fibula, again, I repeat, is another bone you don't need to know left from right. It's hard. That's why I'm just eliminating it, so you're not wasting your time trying to figure that out. But the fibula is not a weight-bearing bone. The fibula is there for what purpose? Surface area for muscle attachment, right. So what you're not seeing here, and what you have to picture, again, is there's interosseous membrane, this dense connective tissue, that sits in between tibia and fibula. And that, again, provides a lot of surface area right here on the outside of your leg, right to the lateral part of your shin. You guys feel that muscle? That's your tibialis anterior muscle. Well, guess what? On the posterior region, we have a muscle that sits there, and that's called your posterior tibialis muscle. And they wouldn't exist if there wasn't interosseous membrane in between here to allow that anchoring point. We're going further down, and now you'll see that we are in the ankle region. Now there's two bumps on your ankle, one on the medial section side and one on the lateral side. And the tibia, being medial, produces this bump right here. This is known as the medial malleolus. Malleolus. This is the lateral malleolus produced by the femur. I'm sorry, what am I saying? The fibula. Okay? So this is a tibia, and this is the fibula. Do not call this a fibia. Please. You'll get laughed at. Okay? Tibia, fibula. Right here is this inferior articular surface of the tibia, and that articulates with the ankle. Okay, the first tarsal bone, which is known as the talus. Kai, will you stop that? Make sure I'm not running over.